Hi, Dr. Suleiman here. On several of these tapes before, I've talked about the importance of getting a good night's sleep. That if you had insomnia or if you had sleep apnea or any kind of sleep problem that was disrupting your sleep, that in itself increased your risk for getting infection. And by that I meant that your immune system requires or prefers an adequate amount of sleep for it to work most effectively. But today I wanted to talk a little bit about smoking. Now, people understand that patients who have chronic smoker's lung disease or patients who have asthma have an increased risk of infection. And so these things are related in that way. But what I wanted to talk about today is the vaping that has become more and more prevalent over the last several years. In fact, it's kind of ironic that people who were concerned about cigarette smoking and the inhaling tobacco started this process really with the best of intentions. And it's not their fault that the FDA didn't do really a good job of evaluating these products, making sure that there weren't a lot of associated side effects before they became common. They became so common that between, I think, 2006 to 2012, every year the amount of e-cigarettes doubled in usage. So it really became a really common alternative. And it appeared to be okay until people started to note increasingly that there were people developing airway inflammation and irritation related to this. So much so that last year, 2019, there was a period of time when there were multiple people being hospitalized with significant and severe compromise of their breathing related to vaping. Now, some people have mild disease and it passes easily, but most of those people who ended up in the hospital had, in fact, started like that. 45% of them had been seen as outpatients in the office before this ever developed. It then progressed to this more concerning process. So there's been some research looking into it and trying to get a better understanding. One of the things they did find was that the patients who were most likely to get this were most commonly older patients. They had smoked previously, they had heart disease, um, and they were overweight. So they appeared to be at the highest risk. But again, the whole spectrum of this, in terms of who can get this, really covered patients from being much younger through those ages, and the symptoms were from mild to more severe. They also found that the products that had THC in them, or products that had something called vitamin E acetate, were more likely to have been used by the people who developed severe symptoms. So, um, again, the importance of this is that this attempt to not be affected by the ills of tobacco smoking led to the use of the vaping, which in itself has also produced another form of airway or lung irritation, and which by doing that has again expanded the number of people who are at increased risk for complications of the pandemic virus that we're all confronted with now. So it's just another important reason to consider at this time stopping smoking of all of those products, since they do add to your risk of both chronic lung disease and viral infection. So take care, stay home, be safe, and try to give up these products that make increase your risk of the virus. Even here in Hawaii, where we're doing very well with the numbers, you don't need to be in that increased risk group.